Thank you, Assemblymember Schiavo. We are going to just make sure that we are ensuring that we have a robust conversation and also balancing the fact that we have still a very long remainder of the agenda. We are going to go with Dr. Weber and then Mr. Jones Sawyer and then Mr. Patterson.
Thank you, Chair. And seeing the time, and after talking with your chair, I will keep my my questions very, very limited because I do want to give others the opportunity, and I also want to make sure that those who came here have the opportunity to speak. So first, I want to start by thanking the author and the sponsors. I have the utmost respect for the author of this bill, and you know, what you have done once again, or what you all have done once again, is to highlight a significant issue within our healthcare system, not only here in California, but within the United States. Yes, healthcare is a right, but it is not affordable. And there are so many issues, so many obstacles, so many barriers for patients to get the care that they deserve, for providers to be able to provide the care that they should. And, you know, like I've said to many people who have come to talk to me about this is, in my opinion, something that should be discussed and passed at a federal level. It should not be something that California is trying to do alone, but it is something that we should have throughout the country. I am a little confused as to what would happen if this bill were to be passed as is, but we don't have time for me to really go into that. So my concerns. This bill has a lot of holes in it. There's a lot of unanswered questions, and this is a very, very important issue. We're talking about the health care for all Californians, current and in the future. I read the bill in its entirety, all 70 plus pages. And so I'm just going to focus on a few concerns. I'm not going to talk about the grant waivers. Other people have talked about it. I've talked about that before. I'm not going to talk about taxes for people. I'm sure other people might talk about that. One of my concerns is the CalCare board. This bill gives this board tremendous authority. Now, they will receive state and hopefully federal money. However, it is a, quote, independent entity not affiliated with any agency or department. If you look through the bill, if you read the bill, or even just read the analysis, the things that this particular CalCare board is over, which is the financial structure, the provider institution contracts, building maintenance, employee staffing, creating employment structure, negotiating prices for not only drugs, but devices, and negotiating provider agreements. I mean, any and everything this board is over. And despite the fact that it's going to be using state funds, federal funds, there's no significant oversight or accountability or a place for the legislature to input in this board, in this bill as is. And I think that might have been one of the things that Assemblymember Schiavo was getting at. You know, one of my concerns is that in the bill, we passed this, right? And the only thing that prohibits it from actually going into effect is it says a bill would prohibit specific provisions from becoming operative until the Secretary of Secretary of California Health and Human Services give written notice to the Secretary of the Senate and the Chief Clerk of the Assembly that the trust fund has the revenues, and then the California Human Services Agency will be required to publish a copy. That's it. It doesn't say anything about once all of these things are figured out, it's coming back to the legislature so that we know exactly what we would be implementing. There's nothing in here that necessarily states that if CalCare implements a policy, it's got to come back to us. And I think we know of another commission that legislators continuously complain about that has all of this authority to go out here and increase prices, and we have no say, yet we're the ones that represent. So I'm concerned about the significant authority that you've given to the CalCare board with no other input from the legislature. The other thing, I discussed this last week on a bill. By giving providers the ability to essentially decide what they want to do for their patient, putting it in our hands, you discard evidence-based methodology, you discard best practice guidelines, and you essentially decide what practitioners want to do for their patients, right? And that is very scary, because remembering what happened in COVID, just because I have an MD behind my name does not mean that I am practicing evidence-based medicine. And we saw that with providers saying, don't get vaccines, take this weird medicine, right? That nobody says is correct, but I'm the provider and I think that's what's best. It also allows for continued discrimination within our healthcare system, because I, as a provider, can choose to give you a certain medication or choose to treat you a certain way. But another patient that walks through my door who looks different, who may come from a different background, a different gender, whatever, I can impose my biases and my decision. Where now, when you have standards, practice, your standards of how we practice, evidence-based approach. If you start to veer, there are checkpoints, right? And it may even be the insurance companies at time that say, we're not going to cover this medication. It's also expensive, because when you eliminate that step therapy, that says I can choose to, as a surgeon, you come in with pelvic pain, I don't necessarily have to work you up. I can just go straight to a diagnostic laparoscopy. I don't have to go through the steps to say, let me try NSAIDs, let me see if hormonal therapy works, let me try, another thing before I take you for the more expensive procedure. So, concerned about that. I've talked about this also many times around this issue. Allowing California to continue to be competitive to get providers to come here. I am concerned with the way in which this bill is structured, that we would create a system where we would no longer be competitive to get providers, nor to maintain the providers that we have, especially around specialty care. There's a section in the bill that explicitly states there shall be a presumption that Medicare fee-for-services for reimbursement constitute reasonable fee-for-service, which is interesting when just in February of this year, the AMA published an article that says, quote, what doctors wish patients knew about the Medicare physician payment system. And it highlighted the fact that Medicare rates have not kept up with inflation. And actually, when you adjust for inflation, Medicare physician pay over the last 23 years has been cut by 30%. So we are coming out of the box going to provide our providers less money and think that they're going to come or stay in practice here in California. We already have a provider shortage. And if we don't do this correctly, we'll just worsen that. We are also removing, individual autonomy, which, if someone, one of the things that jumped out at me is that if a person was eligible for an income-related subsidy, right, and they decided, I don't want it. I don't want to apply for this. In the bill, they have to. They have to apply for it, and if they do not, then they will lose their CalCare coverage, right? If they haven't applied or provided the information within 60 days, it's gone. And so I'm very concerned about some of the things, the way in which that are actually in the bill, not the concept. We have got to fix our healthcare system. But the things that are currently in the bill are very, very concerning. And the fact that if this passes as written, it doesn't come back to us at all. All of these things are done. All of these things are implemented. Let's say the money gets there. A letter is just sent stating the money is there. CalCare is off and running. And so, I think that there's a lot more work to be done. Definitely appreciate your persistence with this and the sponsor's persistence with this. But I think that this is so important that if we're able to do it, we need to do it in a manner that will actually help Californians and not ultimately end up harming them. So thank you.